I'm going to introduce our first facilitator of the day that will be taking us through a session on risk assessment and mitigation. Sandra Agondeze is a medical lab scientist that is certified by IFBA in biorisk management with expertise and diverse knowledge and experience in implementing biorisk management systems, including training, mentorship, support supervision. Yes, let's welcome Sandra Agondeze to take us through the session on risk assessment and mitigation. You're most welcome.
The key terms, we have biorisk assessment, which is the process of identifying hazards and evaluating risk associated with biological agents and toxins, taking into account the adequacy of the existing controls. In the process, we shall decide whether or not the risks are acceptable or not. This is according to the ISO 2019-35001 for biorisk management. Risk mitigation actions and control measures that are put in place to reduce or eliminate perceived risks. You can't talk about biorisk assessment and mitigation without talking about performance, which involves evaluating the effectiveness of your control measures put in place. After assessment and mitigation, we have to do the continuous improvement process and maintaining the system. Normally, most of what our systems are in Africa, after a catastrophic event, we do a biorisk assessment, do mitigation, and end there and wait for another catastrophic event to prevail. But we normally forget performance, which is very key in maintaining our system, such that in case of any other outbreak, we are ready. So the question is, are we ready? How are our systems in regards to African GCBRs are concerned? Then we have biosafety. These are practices and controls that reduce the risk of unintentional exposure or release of biological materials. Then biosecurity, which are practices and controls that reduce the risk of loss, theft, misuse, diversion, or intentional unauthorized use of biological agents. And our biorisk is a combination of biosafety and biosecurity risks. There are different types of GCBR scenarios. We've already discussed this, but just a recap of the natural pandemic, so I will apply biosafety measures. In case of accidental release, we have to, for example, engineered pathogens, we apply biosafety measures, and deliberate attacks, we apply biosecurity measures. So let's go to our risk assessment strategy. How is our risk assessment conducted? You describe the work activities. This involves estimating the potential severity of harm and the likelihood that harm will occur. Then you identify the different hazards that would result into harm. Then you determine the risk, and in risk determination, we look at the likelihood and potential severity of harm. Then we decide whether the risk is acceptable or not. If it's acceptable, then you proceed to work, but maintain controls, performance. Then if it's not acceptable, you prepare a risk control action plan. Develop a list of inventory, different actions, you prioritize, you characterize this risk in terms of likelihood and consequences, in terms of low risk and high risk, in order to maintain and apply the appropriate control measures. Then if they know, you revise your system, you revise your risk assessment strategies, you revise your control measures, then you implement. And this should be reviewed before implementation. Then afterwards, you review the adequacy of your control plans and still maintain, which is performance. let's look at the risk assessment strategy of risk evaluation. In evaluation, we are trying to determine the likelihood and consequences of an adverse event in case of GCBRs. These are called isoquants of risk evaluation, where we have very low. We categorize our risk in terms of very low, high, moderate, depending. For example, we have an example of a plane crash. What would be the risk of crashing in a plane accident? We know when it comes to plane accidents, the likelihood will be low, but the consequences will be very high. So you can see the likelihood of crashing a plane accident. The probability that a plane will crash will be very low, but in case it crashes, the consequences will be high. Then when it comes to risk of crashing in a car accident, we all know car accidents is moderate, and when it comes to the consequences, they are also moderate, depending on the different mitigation measures in place in terms of the seat belts. You have a driving permit, you're trained on how to drive. Yeah, so here I was saying, when you're doing a risk evaluation, a risk assessment strategy, what is acceptable risk? We are saying there is no systematic way of evaluating the risk and determining risk acceptability. However, it depends on the different factors in terms of culture, experiences in risk evaluations, and this involves also training, resources available, management in terms of decisions and support, and even the current events. In case there are outbreaks, then all these factors can influence in determining whether the risk is acceptable or not. And then why risk assessment? Why is risk assessment very important to do prior to implementing risk mitigation controls? These are questions for us so we can answer. What resources would you expect? What outcomes would you expect when mitigation is based on a thorough risk assessment? In here, we try to think, if we don't do risk assessment and we just mitigate, what will be the outcome? Would it be very effective or not? What would you expect if mitigation is implemented without conducting a risk assessment? What would be the outcome? When you answer all those questions, then you look at performance, maintaining your systems to ensure that in case of any outbreaks, in case of any GCBRs, you're ready because your system is well maintained, you've done risk assessment, you've done trainings, and implemented different control measures. So in case of any catastrophic events, you're ready and you're able to respond appropriately. What would be the timing of risk assessment? Which we are saying the timing could be during changes in facility operations, an incident, accident, facility-associated infections, any event where a potential for harm is identified, during non-conformities after safety audits. These are conducted during performances to check your system. So in case you realize the non-conformities, you still do a risk assessment and implement appropriate mitigation measures. Then user feedback, like community feedback, customer feedback, client feedback, you still do a risk assessment. Then periodic reviews. In case of new techniques and technologies, then during outbreaks or outburst of events, you still do a risk assessment. Then when it comes to risk mitigation processes, what will be the different processes you go through in conducting a risk mitigation? You prioritize the risks. Having done your risk assessment, you prioritize the risk in terms of likelihood and consequences. Then you evaluate your risk using the risk assessment matrix, yes. Then you choose and describe an appropriate risk control measure and mode of risk communication. You outline the different resources required. That's why we're saying in every risk assessment and mitigation, you need management commitment. You need different policies, different actors in place. You can't work alone because you need to you need resources, you need a budget, you need different actors in place. Then you evaluate your effectiveness of control measures. You review and evaluate. If in case it still after conducting mitigation processes, you still conduct a risk assessment in case they are not appropriate. Then you continue the cycle. Let's look at the different of hierarchy of controls. We are saying it's most effective controls from number one. As you go as you go low, that it's least effective. Why? Let's look at elimination and substitution, which involves removing the hazard completely, not working with that agent or replacing the hazard with something less dangerous. That is most effective. For example, quarantine. If someone has COVID and is at the airport, they are prevented from mingling with the population. For example, in Entebbe, that means it's very effective and there will be less spread of the disease. When it comes to engineering controls, we're looking at the design of our facilities, the machine work processes to make it safer. Then we look at administrative controls, the rules and regulations, the different guidelines in place, including training, and the different processes followed by or implemented by workers. Then practices and procedures, the signage system to make the work safer or the environment. Then PPEs are least effective because they protect the worker, they protect the person alone. They do not protect the neighbor or the environment, which involves the protective clothing, the masks, the respirators. We are all familiar with PPEs. So you can compare why most effective from number one and least effective number 5, because when you look at elimination and substitution, you're doing away with the risk completely. But with PPE, we are just protecting ourselves, but not the environment. Still, the risk will still be available, will be there. So, and then we are saying only one mitigation measure is not appropriate. You need to apply all the different mitigation measures in place. Sensitizations at the same time, quarantine at the same time, PPE for effectiveness of our controls. Then what is considered in choosing the appropriate mitigation measures, we are saying in terms of low risk, you look at, is risk acceptable? Is there no further action necessary? Then ensure that the controls are maintained. Then to moderate, to high, to very low, the different considerations in place in order to ensure that your mitigation measures are really correct and working. These are the different guidelines you follow. For example, when it's very high, when the risk is very high, this calls for immediate assessment, senior management considerations, everything, detailed control plan. Then the resolution is 1 month, everything has to be in place, everything, immediate response compared to when the risk is very low, but doesn't mean that you don't maintain controls, performance at every point, at every step. About stakeholder involvement, we need public health and medical, the public sector, the veterinary sector, Ministry of Health, pharmaceutical and pharmaceutical companies. When you look at the risk assessment and mitigation and GCBRs, because safety is everyone's business. The safety and security, law enforcers, the military, civil society organization, research institutions, animal fisheries, every sector in terms of safety and security has to respond. Then governance and policy, the humanitarian aid, UN agencies and other members, then the community, the general public. Normally, when it comes to stakeholder involvement, at times we forget the general public, and yet this general public, if they are not considered, for example, we saw the case of COVID where people are spreading different information because of the different media, the social media, internet, and everyone else had their own perceptions about COVID, like we saw yesterday in risk communication. So the community really needs to be considered. The different roles will be in case identification and management, risk assessment processes, for example, agent identification, the humanitarian response in case of any suspicion of deliberate use, in case of any investigative response, in case of recovery, then ongoing response and recovery as well. Thank you. We've come to the end of the presentation.
Thank you very much.
Thanks, Sandra, for this presentation about the risk assessment. Indeed, I don't have any questions, but I would like to contribute or comment about the risk assessment. As you mentioned in your presentation, the risk assessment need or depend on many factors, and also we should consider many stakeholders when we conduct risk assessment. Also, I would like to state it that the risk assessment is a subjective issue. Dr. Tim, the first day says that it is so difficult to quantify the risk assessment because we don't know all the factors or all the informations which affect either the likelihood or the consequences. So risk assessment is very important, but also it is very difficult to quantify it or to get consensus about the level of the risk assessment of the same things in the same labs from different scientists or from different technicians working on these issues. So indeed we need, as a biosafety and biosecurity expert working on the risk assessment much more to or make a model like mathematical models to try to transfer the subjectiveness of the risk assessment to be more objective by some way. So thank you for these presentations, and go to turn to Ian. Over to you, Ian.
Thank you very much, Dr. Ali, for that comment. Do we have any other comment or
thank you for your presentation. Sometimes it's difficult to have a low risk assessment. So if you have some situation, what do you advise for the people? What do you say? For example, if the only situation is the elimination of the pathogen, elimination of what you do in the lab, or after this we have a political decision. Sometimes is difficult to cannot do this work. What do you say? What do you think about this?
Thank you very much for that question. Just like you've already mentioned that at times elimination is a difficult decision by the government to take or by the policy makers, much as it's the most effective. And like we always say, when it comes to mitigation control measures, only one mitigation measure cannot be very effective. Because, for example, elimination is very expensive. We gave an example of COVID response where there was quarantine. The government would support, government ministries would support people be quarantined in case they are exposed. But you realize that it was quite expensive to maintain. I mean, just imagine you have over 200 cases, quarantine for 2 weeks. Is it really feasible? And when you look at Africa settings and resources, so it may not be possible at times, but you also have to sensitize the communities. Much as you're looking at elimination, you also do sensitization such that in case you fail because of resources, at least the community is sensitized. There are different SOPs in place being followed and other responses. That's why you look at administrative controls, engineering controls, practices and procedures. People are following the SOPs, trainings, different in case you fail to do elimination because of resources. Thank you.
Okay, thank you, Sandra. I have a question. They try to develop an application for risk evaluation where you have some questionnaire, and according to questionnaire, give answers, and score are attributed, and at the end, you have a report where you have your risk assessment. So if you, in this case, can you say that risk assessment is still subjective?
Thank you very much. There are different applications that are used for risk evaluation. For example, there is what we call the BioRAM. It's a software that can be used so easily for risk evaluation. If used and trained, it can be very effective. Thank you. I don't know whether I've answered your question very well.
Approach. BioRAM, okay, it is a software, but still we have subjectivity in this, because in the BioRAM we put numbers, and these numbers can be differ from me to Dr. Tim, and differ from Dr. Tim to Dr. Magid, etc. So this is the problem in subjectivity. We are differ in our evaluation. Whatever, if I put 1, Dr. Tim put 2, Dr. Magid put 3, this is the problem. The problem arises here, not the problem in the software. Thank you.
Okay, thank you very much. Yeah, subjectivity matters, because also, like we've already seen, that when it comes to risk evaluation, sometimes there are different factors involved in terms of experiences, in terms of training, in terms of personnel, and the magnitude of the event. That's how subjectivity comes in this case, basing on personnel's experiences and resources involved. It matters. Also, the number of people involved in deciding whether the risk is acceptable or not. It will depend on all those matters. Thank you.
And the problem, there's a couple of problems with tools which claim to be objective. Dr. Ali's mentioned one is that we introduce subjectivity as soon as we put a value on something. Even if we try and avoid that by putting in binary questions, do you have this capability or do you not? Sometimes that becomes subjective. We have a partial capability. Do I say yes or no? And there's a bigger problem with metrics in general. Albert Einstein famously once said, sometimes, what is it? I'm blanking on the quotation I was going to say. But essentially what he's saying is some of the things that we measure matter, and some of the things which matter we can't measure. Yeah, some of the things we can measure don't matter, and some of the things which matter we can't measure. And if we focus too much on objective metrics, we may be focusing on details rather than the bigger objective. I'll give you a horrible example of that. The British National Health Service decided that the performance of their emergency rooms was not adequate. It was taking too long to see patients and deal with them. So the government basically instituted a metric system to measure how quickly patients were being treated upon admittance into the emergency room. And there were penalties for hospitals that did not meet the metric. So they were required to get X% of their patients treated within 1 hour of admission. What happened in one hospital is that instead of improving their performance, what they did was they refused to let ambulance drop people off in the admission room until they were ready to treat them. So ambulances were circling the hospital until they were told they could come in, and patients were dying in the ambulances while they were waiting to get admitted. So when we try to create objective tools, we can sometimes miss the big picture, and we can become focused on the things we've decided to measure rather than the thing that's important.
Thank you very much, Tim. Yes, Sandra?
Thank you very much, Ian. Sandra, thank you for that presentation. I wanted to address myself to the matter of costs. From where I stand, the term cost is relative, and I want to share an experience where we have been having medical labs accreditation under ISO 15189. Hitherto, this process was only domiciled in down south in the Republic of South Africa, and what emerged was that the majority of the labs that were accredited were actually in the private sector, leaving the public sector without anything, which created a lot of concern, because then majority of the African population seeks medical care from public facilities. So city came up with something to do with the stepwise laboratory improvement projects that were preparing labs in public sector and those within the faith-based organizations to achieve accreditation. And it was stepwise because at every level you are scored. We all know that the standard way of accrediting a laboratory is either you have it or you don't. But in this process, they are given time to improve on the nonconformities until they reach step 5, when they can seek accreditation. This program did very well, and in a way it has assisted us in having labs, most of the labs in the public sector, accredited. I don't know whether this is the situation that our colleagues from the North have experienced, where labs are assisted to come up in the process of accreditation as partners take care of the costs, so that eventually the accreditation is achieved. I would want to hear the experience from the North, because in this process also there are issues to do with risk assessment and mitigation, just as Sandra said. So I want to see if we can leverage on such an arrangement to ensure then that things are happening. Thank you. Okay, I was alluding to the fact that medical lab accreditation in Africa has been a tall order. So, and in a survey that was conducted in the Republic of South Africa some years back, it was discovered that the majority of the labs that were accredited were in the private sector. We all know that in the majority of the people in Africa seek medical care from public institutions. So if that situation was going to be left, then it means then that there's no public lab that was going to be accredited under ISO 15189. So this experience I'm sharing from West and South Africa, I wanted to know if there has been any arrangement in the northern part of the continent where public labs are supported by partners funded mainly by CDC to achieve accreditation, because then we would also want to do the same in these matters biosafety, biosecurity. Thank you.
Indeed, we have a model in Egypt. It is recently established. We are already established an agency, a national agency belonging to the governorate, responsible for oversight and firstly, before oversight, responsible for registrations of the all labs. They are focused currently on the private labs, and the future or the strategic view of this agency is to involve the public and the labs belong to the academic hospital. So this organization called GUHAR, this is responsible for, as I mentioned, registrations and oversight of the labs, I mean public health labs. It started 2 years ago, and they make accreditations and provide accreditation and help the labs to be accredited. They focus not only on the biosafety and biosecurity, they focus on the many public health issues involved with the biosafety and biosecurity, but in minor ways. We're trying to cooperate with this organization by some way to enhance or to strengthen the biosafety and biosecurity issue in their oversight. I think this is a good example for entity, national entity, which can be registered and oversight and accredited public health labs. Thanks. Over to you, Ian.
Thank you. Thank you very much.
Yes, we have one more comment from Dr. Dan.
Okay, in West Africa, you have a project that names ProLab, which is supported by German cooperation. That's the KFW, who is supporting a public laboratory in West Africa for accreditation.
I'll comment. I'd like to thank to thank Sandra for the presentation and all those who have reacted to that presentation.